Facial rejuvenation can start as early as in your teens, and it's often better to start early, sort of as a maintenance procedures, microdermabrasions, facials, collecting further toward Botox, then injectables. After that would be something like a facelift. So it's a big spectrum of things. The reason people go to non-surgical options is the downtime is less. New technologies such as fractional resurfacing coming out, the portrait plasma, injectable fillers, and Botox make facelifts something that people can put off for a while. Generally, a doctor that's board certified in a field that's commensurate with the procedure you want, I feel strongly about it. At least for a facelift, you should look for a board certified plastic surgeon. I don't know any other specialist more qualified. As far as the other stuff to the skin, as long as they're a board certified entity of dermatology, ENT, or even oral surgery, dual degree oral surgeons, I think that would be okay. The general risks, going from the easiest or procedure that's less invasive, would be unhappiness with the result and inability to understand that these smaller things that you do don't give the dramatic results as far as a facelift goes, but it has less downtime. I'd say the number one risks are infection, allergic reactions, redness, bruising. Those are the main ones for the smaller procedures. We've gotten to a point where most procedures can be done under IV sedation. Some patients with a little bit of local, or in the case here, I can do it under oral sedation with local. As long as the local anesthetic is in, you don't feel it. A minimally invasive procedure, such as a Botox or filler, usually somebody can go out that night. If they're on blood thinners or something to make them bleed, they'll obviously have bruising, and that's variable, 1 to 2 weeks for the bruising. A facelift, you're looking at one week to 10 days before being seen. However, with these minimally invasive facelifts, we've gotten people out in public in 4 days with camouflage makeup. The skin's an interesting organ. It is an organ of the body. It can vary from sun damage to acne to loose and hanging skin off the jowls. And we can improve on that via chemicals, laser peels, or facelift. A couple of things. They're coming out with some new fillers. We're trying to find the best filler, and there is no best filler. However, they are working on them. I would say, again, the fractional resurfacing, coming out with fractional CO2 resurfacing via one of the many machines. For example, Dot Therapy or fractional soot therapy are all going to be excellent choices. Within about 2 or 3 weeks, they come back, they're very happy. They say their friends think that the number one thing that they tell them is that they've slept longer. Did you do something different? Without really knowing what they really did. Unless, of course, there's bruising, which we can't really control. Facial rejuvenation is a continuum. We can go something very small and light so that you can go on with your days. We can get something a little heavier, a little bit more downtime, but with a little bit more improved result. That's something up to you, and we can do it all here.